Hey everybody, I'm Maggie. We're back on SRH Access, Facebook Live. Today's a very exciting day because we're actually doing our first segment about our quality department. I'm here with our Director of Quality and Safety, Kerry Wilder. Welcome. We're so excited to have you. We're excited because there's just been some really cool initiatives going on since you've come to the hospital. You've been here a couple years, right?
Yeah, 3.5 years.
That's awesome. Well, we just want to get into what you guys do as a department to really help out our patients. So to start out, what is the importance of quality and safety for our patients?
So quality and safety is vital to every children's organization, every healthcare organization in this country for sure. What we do is we protect patients from maybe processes that aren't exactly working perfectly, and lots of things happen. We're a complex industry. Lots of different nursing, physicians, everybody kind of at the bedside doing a lot of different things, medications, IV fluids to hang. And so what we do is we really look at all those processes and try to keep them simple, keep them efficient, so that the patient is safe in the bed so people don't make unintended mistakes.
Definitely. And then, so I know you're the director, so in terms of the department, can you kind of explain who's in the department and maybe an example of kind of what they do?
Sure. So we're quality and patient safety, and so I have, we oversee the quality improvement program, we oversee the patient safety program. So Sharu Sharma is our program manager for patient safety, and she's responsible for aligning all of our best practices with our benchmarks across all the children's hospitals in the country. We are a patient safety center, which means we belong to the Solutions for Patient Safety, and we really track about 12 hospital-acquired conditions. Those things like inadvertent falls, surgical site infections, maybe catheters that become infected, and other areas. We also are looking at the culture of safety, and so we want to align all of those strategies within that Solutions for Patient Safety. So she has a really important role for organization because she is all things, we call her all things SPS. And then we oversee infection prevention. So Chris Geyer is our certified infection prevention specialist. She is a nurse, and she does all kinds of stuff for the Dallas campus as well as the Frisco campus. And then we also oversee the accreditation program, which is the Joint Commission standards, and aligning what those standards are, making sure that we align that with best practices and our patient safety program.
That's great. And you were mentioning infection control and all of that, and I think that's something that maybe as a parent might be a little scary. I mean, you have a child who's coming in for surgery and they're seeing that there's so many percentage of infections and stuff. Like, can you kind of explain maybe what that is, and maybe
Sure.
more of a process of how you guys are monitoring that?
Sure. So I came about 3.5 years ago, and one of the things I wanted to look at is bring a multidisciplinary group of people together. So, from pharmacy to nursing to physician, all of the disciplines that would, touch a patient, and really look at building in some patient education processes to help reduce our surgical site infections. And so one of the things that we've done is develop a preoperative chlorhexidine wipe process before surgery. And so this is a medicated wipe that we have instructed families to use head to toe before they go into surgery to help prevent infection post-operatively.
That's great. And I know that we're really involved with NRC Health, and we've actually won an Excellence Award several years in a row. So
Yes.
maybe kind of give some insight on it, because it's really exciting.
Yes, thank you. Yes, it is very exciting. I have never been part of an organization that has won this particular award 4 years in a row. And so we have won overall rating in top performing children's hospitals across the country. So all the freestanding children's hospitals are in our competitive market, and so we've won that overall rating 4 years in a row. And so what that means is, and we always say quality is defined as what the customer says that it is, right. So it's very important for us to have a good patient and family experience for our families. And so satisfaction is the survey or the tool that we use for families to be able to tell us, how their experience was that day. And then from that, we can sort of, improve processes by listening to their voice.
So it sounds like, I mean, it's really important that that when families are given that survey that they take, is that
Yes.
all families are given that,
Yes.
or is it, okay?
Yes, so we have an inpatient paper tool,
Mhm.
and it goes out to all of our families that are discharged that meet that inpatient criteria.
Okay.
We also have a real-time survey for the clinics,
Mhm.
and then also for day surgery in our ambulatory surgery center in Frisco. And so they will fill out a survey 24 to 48 hours after they're discharged from the clinic.
Okay.
And so we get that feedback really timely,
Mhm.
and we're able to act on that and hopefully match, if we have a negative comment, we can reach out to that family, find
Right.
out a little more detail, and hopefully make a better experience for them the next time.
And it just sounds like it's always a learning experience,
It is.
which is so great, because I mean, it just means that we're getting better.
That's right. Yes.
So I want to touch back on the multidisciplinary part of this department, because I think it's such a really cool aspect of it.
Okay.
So I know that our doctors are really involved in this. So can you kind of
Yes.
talk about who is involved in
Sure.
the importance of having their support?
Yes, so physician champions are
Mhm.
so important. So Dr. Amy McIntosh
Mhm.
is our physician champion for the Surgical Site Infection Committee.
Mhm.
And without her partnership and leadership, we wouldn't have been as successful as we've been.
Mhm.
She is the expert for spinal fusion surgeries, whether it's adolescent idiopathic or
Mhm.
whether it's a patient with underlying neuromuscular disease. So she really brings some of those best practices. She helps really get us into the literature, the published literature, to help us maybe fill a gap that we're seeing in our processes here
Right.
at Scottish Rite.
Yeah.
And so without her partnership, we wouldn't have that type of leadership.
Mhm.
The other thing I think that's important is she also is the voice back to the spine team, the medical staff.
Mhm.
And so we present our interventions, our best practices, and then our data and how we're doing every quarter
Mhm.
to the medical staff as a group. And then we get their feedback, we get their buy-in. So again, without her partnership,
Yeah.
we really wouldn't be where we are.
That's so great. And I think to kind of round things out, I know that we were talking about the importance of educating patients and their families and making sure that they're understanding kind of this language and verbiage of
Yes.
quality. But in terms of staff, what is happening in terms of educating them in the importance of providing this quality care?
So that's a great question,
Mhm.
because we can always say within quality, if you don't have a good clinical education program,
Mhm.
really I can identify gaps all day long, we can align best practices, but if we don't have a good education program, it never gets to the frontline staff to then be implemented. And so here we have Christy Pittman.
Mhm.
She is a clinical educator here at Scottish Rite, which is a new role for the hospital, and she's really done a phenomenal job at taking what we've put together and sort of, we always say, take it, make it look pretty, define your
Right.
audience, and then she goes to the front line, and I do as well. We go
Mhm.
together, and then she will educate based on those education principles that she's learned in her master's degree program. So
That's so great. That is
Yeah.
really awesome.
So we engage families, we engage staff, we have a very systematic way that
Mhm.
we do this so
Yeah.
that we can sort of tell the story, get buy-in from the medical staff, get buy-in from our administrators as well.
Right.
Matt Chance and Debbie Sales
Mhm.
have been extremely vital in this
Mhm.
support of this initiatives as well.
Such a team, and it sounds
It
like
is.
it's been very successful.
We have a great live question from
Okay, here we
Sharu.
go.
She asks, how do you differentiate between quality improvement and research?
Okay,
That's a
so that's
good
a great question, and we do struggle with that a little bit here,
Mhm.
just like anywhere else. So quality and evidence-based practice is taking existing literature that's already published out there.
Okay.
Taking it, quality is identifying and analyzing gaps in practices. So quality and evidence-based practice marry each other, and you have to have existing knowledge for that. So in research though, research is generating new knowledge. So it's hypothesis driven, so you're
Mhm.
asking a question and you're solving that one question in a randomized control trial, for
Mhm.
example. So where research is very, very important is when they identified a gene in AIS, adolescent
Right.
idiopathic scoliosis. That is not what quality does.
Mhm.
We don't generate new knowledge. We take existing knowledge and then incorporate it.
Okay, and then kind of analyze it and see
Correct.
trends or whatnot.
Yes, and we have to have enough evidence out there. So you wouldn't take one article and call that a synthesis of evidence.
Mhm.
You would need to have substantial evidence maybe 5 or 10 articles, depends on the study.
Right.
That then we would say, yes, now that's enough evidence
Mm-hmm.
to then incorporate that into clinical practice.
Awesome. Very cool. Lexi, do you have any more?
That's it.
All right. Well, Kerry, thank you so much for joining us. This was awesome,
Thank
and I think
you.
people will really learn a lot about our program here, which is really, really exciting. So thanks so much.
Thank you so much for having us.
All right.
For
Well,
sure.
we'll see you next time.
Bye.